Hello, I'm Dr. Margaret Co. I'm an allergist. I'm part of multi-specialty practice, Bergen Medical Associates, that is part of Pascack Valley Hospital and the Hackensack Meridian Health Center. I see patients in Paramus and Emerson, and I have been in practice for over 25 years. I am here today to discuss the difference between seasonal allergies and COVID-19 infection. Thank you for joining us. I'm happy to answer all your questions.
What is the difference between seasonal allergy symptoms and COVID-19?
So the question is, what is the difference between seasonal allergies and COVID-19? So COVID-19, as all of us know, is a contagious respiratory illness, and it is caused by infection with the novel coronavirus. It is a respiratory infection similar to influenza and the common cold, and it is highly contagious through respiratory droplets and aerosols. Whereas seasonal allergies is a condition that is triggered by airborne pollen that can lead to seasonal allergic rhinitis, which affects the nose and sinuses, and seasonal allergic conjunctivitis, which affects the eyes. So in New Jersey, this time of the year, the most common prevalent cause of seasonal allergies is tree pollen, which is emitted by the trees that are pollinating, as well as a little bit the start of the grass pollen season as well.
Second question is, what are common symptoms between allergies and COVID-19?
So the second question is, what are common symptoms between allergy and COVID-19? So COVID-19, both of them share some symptoms, but they also have very unique symptoms. So let's start with COVID-19. For example, COVID-19 presents with fever. And as we all know, people who have seasonal allergies do not have fever. But what are the other main symptoms of COVID-19? 90% of patients with COVID-19 present with fever. About 68% present with a dry cough. 33% with a cough that is productive, meaning has some sputum. 19% have shortness of breath, and 14% with a sore throat. Only about 5% of patients with COVID-19 infection have nasal congestion. Other symptoms of COVID-19 would be chills, muscle and body aches, and interestingly, a new loss of sense of smell and taste. A few patients with COVID-19 have nausea and vomiting and other GI symptoms such as diarrhea. And not as frequent, but we've also seen patients with COVID-19 present with conjunctivitis. So as you can see, many of these symptoms can overlap with allergies. With seasonal allergies, the predominant symptom is runny nose and stuffy nose, as well as itching of your nose and eyes, and sneezing and itchy, watery eyes. So if somebody is itching, most likely that is seasonal allergies. If somebody has a fever, most likely that is COVID. Now, a cough can be present in both COVID-19 and seasonal allergies. Usually a cough from seasonal allergies is from a postnasal drip. Shortness of breath can also be found in both conditions. However, shortness of breath in allergies usually exists when somebody has a pre-existing lung condition or asthma, which can be triggered by exposure to high levels of pollen. Fatigue can be found in both COVID and allergic rhinitis. Fatigue with allergic rhinitis very often because people are not sleeping well or maybe due to side effects from medications taken for allergic rhinitis. Headache is another common symptom that you can find in both. Sore throat. In COVID, it's about 14% of individuals. Sore throat can be present in allergic rhinitis or seasonal allergies because of a postnasal drip or maybe because of predominant mouth breathing because their nose is congested. And lastly, a congested and a runny nose can be found in both COVID and seasonal allergies, although it is much more common with seasonal allergies.
Are people who suffer from allergies at higher risk for contracting COVID-19?
So the question is, are people who suffer from allergies at higher risk of contracting COVID-19? There is no evidence that people who have allergies are at higher risk of getting COVID-19. There's also no strong evidence that people who have asthma are at higher risk of contracting COVID-19. So the answer is no.
Is it possible to have allergies and COVID at the same time?
Is it possible to have allergies and COVID-19 at the same time? Definitely yes. Patients who present this time of the year, so with tree pollen, the tree pollen started becoming a problem this spring around beginning of March. It is peaking right now, end of April and May. So people who got COVID following the winter, with exposure in January and February, can very well get symptoms. As we know, once you're exposed to COVID, you can get symptoms between 2 to 14 days after exposure. So if you were exposed to somebody with COVID in February and March, and at the same time the pollen is starting to rise in levels, you can very well have both COVID and allergic rhinitis. So if you have symptoms of allergy and you also have symptoms of COVID, my recommendation is that if you have symptoms that are mostly seen with COVID, such as a fever, then that would definitely be a big hint to you that you are infected rather than your symptoms being due to allergy. So the presence of fever is a strong indicator that most likely you have COVID in addition to your allergies. Also, the onset of a new loss of sense of smell or taste is pretty consistent with COVID, although people who are nasally congested because of their allergies can also have that. But that is a pretty unique symptom that we are finding with COVID, that all of a sudden you lost your sense of smell and taste. Also, if you have GI symptoms, again, which is present with COVID but not with seasonal allergies, that might be a hint that you have COVID and not just seasonal allergies. But yes, they can both affect you at the same time, and the symptoms can be confusing. So if in doubt whether you have COVID at the same time as your seasonal allergies, I strongly recommend that you get tested.
If I don't usually take allergy medicine, should I take it to prevent an allergic reaction to the vaccine?
So we do not recommend that you take an antihistamine specifically to prevent an allergic reaction to the vaccine. The reason for that is that the antihistamine, so an antihistamine works by blocking histamine receptors and therefore preventing many of the symptoms that histamine causes, such as sneezing, itching, runny nose, and hives. Taking an antihistamine will not prevent many of the side effects of the COVID vaccine, which include fever, a swollen arm, chills, and a red inflamed inflammation at the site of the vaccination. An antihistamine will not protect or prevent that. As a matter of fact, we want to know if you are going to have an allergic reaction to the vaccine, and taking an antihistamine may blunt the symptoms, that you're going to have if you're going to have an allergic reaction to the vaccine. It may blunt hives, but may not prevent the more serious allergic reactions to the vaccine. So we do not recommend taking an antihistamine just to prevent the side effects of the vaccine because number one, it will not prevent many of the side effects, and number two, it may even mask symptoms of a severe allergic reaction to the vaccine. If, however, you have severe allergies and you need to take your antihistamines to prevent you from having severe allergy symptoms, then you should continue it for that reason. But there is no reason to specifically take it just to prevent a reaction to the vaccine.
How does COVID-19 affect people with asthma and
How does COVID-19 affect people with asthma and allergies? So COVID-19 affects people with asthma and allergies just like it affects anybody else. As we know, 80% of patients who are infected with COVID-19 can have mild to moderate disease. Um, about 13% of people infected with COVID-19 have severe illness, and 6% have critical illness, requiring hospitalization, mechanical ventilation, and even leading to death. So COVID affects people with asthma and allergies just as they affect the normal population, with the risk of severe disease increasing with advancing age and with the presence of pre-existing underlying medical conditions such as obesity, diabetes, hypertension, and perhaps COPD. The presence of asthma by itself was initially written up by the CDC as a pre-existing underlying medical condition that could put you at risk for severe COVID disease. And they specifically said people with moderate to severe asthma may be at risk of severe COVID. However, that has not been borne out by the literature and by studies. And in my experience, I have not seen that to be the case as well. Patients who have moderate to severe asthma do not seem to be, in my experience, at higher risk of getting severe COVID. As a matter of fact, I have found that in these patients, the common cold tends to trigger their asthma more severely than getting COVID infection. So the presence of severe asthma is not necessarily a risk factor. We need to differentiate that between asthma, allergic asthma specifically, and COPD. So COPD is a risk of severe COVID. However, asthma, especially milder cases of asthma, has not been found to be at a risk.
What are some ways to prevent seasonal allergies and COVID?
The question is, what are some ways to prevent seasonal allergies and COVID? So interestingly, when the COVID pandemic hit us a year ago in March, everyone went into lockdown and stayed indoors and, didn't go out. And when people did go out, they were, as instructed, wore masks. So people who used to have severe seasonal allergies year in and year out in the spring had very mild symptoms last year. And again, that was a combination of people staying indoors, people wearing masks when they go out, and avoiding outdoor activities, such as sports activities. Soccer practices were canceled, and so people didn't spend as much time outdoors. And so in a way, being in lockdown and staying indoors helped people with seasonal allergies. So how do you prevent seasonal allergies this time of the year? Avoiding the exposure to outdoor pollen, especially when the pollen counts are very high. And those days are specifically days when it is very hot, dry, and windy. And that's what moves pollen around. So you want to stay indoors as much as you can or avoid staying outdoors for prolonged periods of time. You want to keep your indoor environment a pollen-free environment, meaning shut your windows. Individual air purifiers in rooms that you spend a lot of time in would be helpful. Try to avoid outdoor activities as much as you can, but when you do, and you do come indoors, it's very helpful to remove your clothes, especially if you've been raking leaves or cutting the grass. Remove your clothes where pollen has gathered. Also, shampoo your hair and take a shower. Wash your eyelids to remove pollen that has accumulated on your eyelashes. So practical things like that can help reduce your exposure to seasonal pollen. When you're in the car, keep your windows closed, hit the recirculate button, and put the air conditioning on if it is hot. Some ways to prevent COVID, as you have been fully, told to by the CDC and your health professionals, it is very important to wear a mask when you are out, when you are among people, especially not in your own nuclear family group. So wear a mask when you're indoors, wear a mask when you're with other people, stay a distance 6 feet. keep washing your hands, avoid touching your hands to your face, your nose and your eyes, and avoid musty environments. Eating indoors, such as restaurants, can be a high risk, especially if crowded, because that's when we take off our masks. Wearing masks during this time of the year will help you avoid inhaling pollen, although pollen is more microscopic, and so a regular mask will not prevent you from breathing in pollen as much as it will prevent large respiratory droplets from COVID. So wearing a mask when you're outdoors will help both seasonal allergies and COVID exposure.
When should I contact my doctor if I am showing overlapping symptoms?
When should I contact my doctor if I'm showing overlapping symptoms? As mentioned before, if you have a fever, that is most likely a symptom of COVID rather than allergies. If you have a new loss of sense of smell and taste, and you have never had this before with your seasonal allergies, and you are not particularly congested, that should let you go get tested for COVID. If you have chills, that's another symptom of COVID rather than allergies. Generalized body muscle aches and may also be more consistent with COVID rather than seasonal allergies. And if you have GI symptoms such as nausea, vomiting, or diarrhea, which are seen in COVID and not seen with seasonal allergies. Of course, if you have been in a situation where you have been exposed to someone who tested positive and you have symptoms, even if they are not specifically COVID related, if you have had known exposure to somebody infected with COVID, you should get tested.
We have a couple of questions that came in. What can I do to better my life quality if I have allergies and asthma during the season?
So the question is?
What can I do to better my life quality if I have allergies and asthma during the season?
So the most important thing so the question is, what can I do to better improve my life quality when I have asthma and allergies during the season? The most important thing I tell patients with asthma is that you need to make sure that your asthma is well controlled. So, there is some controversy, or there has been some statements about the use of steroids when you have COVID. So you do not want to take oral steroids, just without good reason, because steroids are immunosuppressants, and so they may affect your ability to fight the COVID virus if you're infected. However, that does not apply to inhaled steroids. So if you are an asthmatic and you are on an inhaled corticosteroid, you should continue your treatment in conjunction with, of course, with the advice of your doctor, to make sure that your asthma is well controlled during this season. So whatever you're on, continue. You should not stop your medications. Make sure your asthma is controlled. With regards to patients who have allergies, make sure that your allergy symptoms are controlled. I have many patients who have come in who want to make sure that they stop sneezing, that they stop coughing, because they do not want to do this in the workplace, because people look at them and say you need to go home because you might have COVID. So a lot of people are trying to make sure that their symptoms of allergy are well controlled. So take your medications as prescribed by your physician. There are many medications now that are over the counter. It helps to take your medications regularly during the season because they work better, so that you can control your symptoms.
The next question that came in is, have you heard of anyone with long-standing indoor and outdoor allergies experiencing an unexplained significant exacerbation of symptoms such as sneezing, nose running, or eyes tearing days or weeks after the vaccination for COVID?
So that's a long question, but I think so I think the question said, have you known of anyone with long-standing indoor allergies who, sneezing, runny nose, who had an exacerbation of symptoms following the COVID vaccination? Am I right? So the COVID vaccine has, been associated with allergic reactions. The incidence of allergic reactions to the COVID vaccine, and we're talking mostly of the two approved vaccines here in the US, Pfizer and Moderna, which are both mRNA vaccines. So they have been associated with a small incidence of allergic reactions. Usually these allergic reactions are, always, these allergic reactions are immediate within the first hour or two. There have been a few cases of hives, difficulty breathing or shortness of breath, and even full-blown anaphylaxis. In this country, the incidence is very low, probably around 5 to 10 per 1 to 2 million, depending on which vaccine you're talking about. These reactions occur, on the same day of injection and resolve within 24 hours. The incidence of death due to allergic reactions to the COVID vaccines in this country is 0. So we consider this vaccine in terms of allergic reactions to be very safe. In terms of long-standing reactions, there have been delayed reactions associated with the vaccines, specifically the Moderna vaccines, with patients showing a local reaction or swelling, redness on their arm, up to 6 to 15 days after vaccination. So these are patients who were vaccinated, did not have a reaction on their arm, but 6 to 15 days later notice redness on their arm, sometimes at the site of injection, sometimes in the same arm, but a little bit further from the site. These are delayed reactions, meaning your immune system has recognized the vaccine and is reacting to it, and in a way this is a good sign that your immune system is doing what it's supposed to do in order to protect you from potential COVID-19 exposure in the future. So there's nothing to worry about these delayed reactions. But to answer the question, we have not seen the COVID vaccine to be related to continuation of long-standing indoor allergies, meaning sneezing, runny nose, or an exacerbation of asthma. That has not been found to be a side effect of getting these vaccines. Okay, so thank you very much. My name is Dr. Margaret Co. I'm an allergist. In practice here in Bergen County. I'm part of Bergen Medical Associates, which is part of the Pascack Valley Hospital and Hackensack Meridian Health Center. I see patients in both Paramus and Emerson. I'm very happy that you joined us today to answer questions regarding seasonal allergies and COVID-19 infection. Thank you for being here today.